everybody. Thanks for joining us at the Transitions RTC National Webinar. We're very pleased to bring you this series of webinars on how to support youth and young adults with serious mental health conditions. Please join our e-blast. You can see a tiny URL at the bottom, but come to our website and you will see a way to sign up for our e-blast and get notices about our webinars in the upcoming spring and summer. So this is part 2 of our series on supporting the education of youth and young adults with serious mental health conditions, state of the practice. And these are acknowledgements. We are funded by NIDLR and by SAMHSA, and through a 5-year grant to the Transitions RTC. And that, by the way, is our web address. Please come visit us. We have a brand spanking new website that we'd be delighted for you to take a look at. Okay, so I'm very pleased to present our next 2 speakers. Michelle Mullen from Rutgers University, who will be presenting on barriers and supports to educational attainment, and some of the nitty-gritty about supported education practice. What does it actually look like? What do you need to do? And Kate Biebel will be presenting on supported education models and the results of site visits that she and us at the RTC have done to some exemplary supported education services around the country. And I'm very delighted to turn this over to Michelle Mullen, who will review her section of this webinar.
So what I was saying while I muted myself was the first day we had gotten together in the part 1 of this webinar is the prevention of disability and illness identity and the developmentally relevant roles of young adults, school, work, making friends, really figuring out who you want to be, and why we need to enhance our current vocational models with special consideration of developing human capital, and why education needs to be at the forefront of services for young folks, because that's the way that we unbreak the chain of what we see with the older adults in our mental health system, and so that they can have a long-term economic self-sufficiency. So today we're going to talk about some of the foundations for strategic educational supports or support education. We're going to focus on college for today. We know that educational supports can be in any academic setting, but today we're going to focus on college. We're going to talk about the barriers for college students and the resources available on campus, and then we're going to do a brief overview of the specialized educational services that are helpful for youth. So for Ryan's story, if those of you had a difficult time hearing, if you do a Google search for Ray's videos, Ryan's story, you should be able to pull this up no problem. But if you heard him saying, like, you know, I went to school and I looked like this, and some of you may have been looking at him and saying, like, oh, in some of my trainings I show this video and people say, oh, I wonder what type of schizophrenia he had, as a way of discounting that it was serious. But what this video shows is that people go through a transformation while at school, and school is a little different than work. Not only does it provide you more equity for better employment, but it also allows you to discover who you are. And the idea of stress is not that it's too stressful to go to school, but rather stress is a typical process of being in school, but this idea of not being able to be successful because of the psychiatric condition was more stressful than the stress of school itself. So I think that we should take home those messages while providing services to young folks, because if they look a particular way now, it doesn't mean that they always will look like that or they will always struggle like that. So being able to be mindful that this is a process where people grow and develop. So I want to also give some credit to the folks I've been working with that have helped me to develop the content for this presentation. Kate will later talk about some of the program, or a program that I helped to develop that preceded some of this work. So our discussion today comes from both practice and research. So while we walk through this process, I want you to start to think about what are the barriers for the general student population. What do college students look like, and what type of supports they have? So think about when you were in college, or if you have children in college, what that looked like for you when you first entered. And some of them is just like an adjustment to a new environment, as you see. Having to figure out how much fun can I have and still meet my course requirements, figuring out academic demands. It's not like high school anymore. You have a lot more access to drugs and alcohol. You're developing new types of relationships and different relationships than you were in high school. Or if you're returning to college later, these friendships look a little different. You're figuring out what are the ways that I can be more successful and how do I manage doing all this and the things that I like to do with the things that I need to do. So managing your course loads and expectations, figuring out what works and what doesn't work. My first roommate, my first semester in college, ruined my first semester in college. She gave me strategies that did not work. They were not logically sound, but I was interested in trying them. So it's figuring out what works and what doesn't work, as well as how do you care for yourself in an environment where no one's forcing you to eat, no one's forcing you to eat vegetables, or exercise, or do any of the things that you need to do to be able to be healthy. So when you think about the barriers, what are the types of things that college students can do to have the adequate support that they need to be able to make through these adjustments and be able to make it through what used to be considered 4 years of school, but now a majority of college students take 6 years to complete their bachelor's degree. So there are lots of tutors, there's labs, there's professors, students, coaches, advisors. You have the supports on campus are amazing, and there's nearly something for everyone there. Finding it, however, is the issue. So then we should think about, okay, so college students have a lot of barriers. They also have a lot of fun, but they have a lot of things to adjust to, and there are lots of services and supports that are available to them. It's a community. It's intended to be a community. But what are the specific barriers for college students? So when we think about for college students, they have everything that another student has, but then they have this additional layering. Selected barriers, these are just selected. There are many, many more, and when I do my in-person training, this is an exercise that takes a very long time. But these are the selected ones that I think highlight some of the greatest needs that college students with psychiatric conditions face on campus. There's stigma, and I think we're moving from stigma to discrimination, so people feel as if they are scared to disclose for good reason. They have layers of their symptoms, which then has academic implications that we'll talk about, side effects of medication. And while there are many, many, many people on campus that struggle with these things, they feel so alone, like they're the only ones, which probably is the worst feeling, to be in a new environment and are struggling with, I'm the only one. In addition to what the regular student feels like, where do I find resources, they also don't know where to find resources specific to how they're feeling and the things that they're struggling with. College students then who have pre-existing mental health conditions when they come to campus have the management of multiple complex systems. If you consider what it looks like to be a college student and dealing with a registrar and bursar and professors, and I mean, it's a lot. And then adding on community mental health if they're a part of that, or their individual therapists, medications, it's a lot to manage. And because of that, there are some additional financial burdens. And as you can see, some of these barriers are not just specific to mental health conditions, but other disability groups and disadvantaged groups on campus. So the academic barriers that college students identify, so they have these emotional or psychiatric layers of difficulty, but then they also have real academic barriers that may or may not be shared with typical college students. We think that this is probably true of young adults on college campuses, period. And we're doing some research to investigate how different it is for college students with psychiatric conditions. But in a study that we've conducted here at Rutgers, and 2 studies, that these are the top academic barriers that are endorsed by college students. And as you can see, they are executive functioning skills, time management, maintaining organization, organizing information, taking notes, prioritizing tasks. This is my aha moment. So yeah, the mental health condition itself and the symptoms, the classic symptoms of mental health, were problematic, and for a very long time we thought that they were the greatest issues. However, when we consider attrition and dropout rate, when you think about the academic barriers, these may actually be the biggest issues. There's no question if you have a hard time organizing yourself and you can't get your assignments in on time because you don't know where they are, you have fun spending all this time working on one assignment where another assignment is due tomorrow that has a greater weight. But this is why we fail out of school. It's not because people struggle with symptoms. While that may be true, there are these other layers that need additional attention. So then when we think about, okay, what do college students struggle with? What do college students with psychiatric conditions struggle with? Then we think about, well, what are the resources that are available specific for these barriers? We have the Office of Disability Services, and we have counseling services, two services that are intended to help this growing number of students on campus. And currently, these specialized services cannot meet the need. They're not currently funded for the growing needs. We see that counseling services are supposed to look like 1 FTE per 1,000 to 1,500 undergraduate students. That's a lot for a person to be able to serve. And we see that disability services, and we had a very, very hard time finding anything published. There is something out there, I know, because we refer to it all the time, but it could be based on about 11% of the college student population, which still is exorbitant numbers of services. And the worst part is, for some of these specialized services, they're not trained on how to provide effective services for college students with serious mental health conditions. So they deal with adjustment issues. They, for counseling services, disability services deals with folks who have learning disabilities, who have physical impairments. Now, we do have some stellar programs across the country, and we'll be talking about one of them. Kate will be highlighting one of them later, but they're often not trained. So we have services on campus that cannot currently meet the need. So we have this great social and academic implications for the growing number of students on campus, but also the lack of specialized services on campus to be able to best help this population. So we know that the implications are there's a high academic attrition rate, so that we drop out, right? So young people, I say we, like I'm young, I know I'm not, but young people with psychiatric conditions drop out of school at higher rates than any other disability group. Young people, just generally speaking, have a low rate of health seeking, so getting people into services is hard. Also, the way that we advertise for student services on college campus does not target mental health conditions, especially for disability services. It targets what people think are, like, oh, if I'm in a wheelchair, I go there, but not if I have depression. Another serious academic implication of not having adequate resources and services on campus is a repeated attempts at school. So in some of our research in the department, we see that people have upwards of like 6 to 9 attempts at post-secondary ed. And so essentially what that means is that people are burning through there financially. So they have high loan default rates, and essentially they have a lot of unfinished coursework, and they do not have a degree. So the greatest issue then for the academic implication is that we have a truncated social capital development as well as human capital development. But as you folks know, you can be successful and have a good life if you don't complete college. Lots of people do. Typically in our services, that's not the case. People end up within the mental health service setting as kind of like their role. But the greatest implication of not addressing the needs for college students is the rate of suicide. So unfortunately, it's the second leading cause of death among college students. And if you consider that 1 in 10 actually have a plan, it breaks your heart. So thinking about how do we talk about mental health on campus, how do we get students into services earlier, how do we open up this discussion is one that is of great need to the services that we provide, community mental health services, as well as college services, right? So we know that there are more than 1,000 suicides on campuses each year, which no one wants to do. That's an unfortunate and awful statistic. So when we start to focus on the services that we can provide, maybe helping students get connected earlier could prevent some of these issues. So the summary and implications, I think that is pretty clear. There's a lot of barriers associated with transition, and students are often not addressed. Students with psychiatric conditions are not comprehensively addressed by campus resources. And so to be able to have really effective services, we have to start to think about how we're then intentional with our services. So as you can see, I have quotes around support education. This is a term that we've used for a very long time and is helpful in thinking about a general approach, but it's not helpful in thinking about the types of services. There are lots of different types of programs and lots of different types of services. So we're going to talk about strategic academic supports for college students with psychiatric conditions. So the way that I train programs and thinking through services, I use the framework of choose, set, keep, leave. And I use it because, one, I was trained in it, I think it makes good sense. But two, is that this is the natural way that people go about evaluating what's next for them. Either they do it by default or they do it intentionally. And we hope to do it intentionally but not take a lot of time, right? So we help the students to choose where they want to go to school, and that's what people come to us early. We want to help them get the things that they need to be able to enter into that school and then stay in school, because that's really what we want to focus on, is how do we maintain matriculation. Getting people into school, that's easy. Keeping people into school, well, we have some good ideas about how to do that. And then we have to think about systematically and really intentionally, when do we have to take breaks, right? So leave can both be graduation, or are we transitioning, are we taking a break, what are we doing? So then practitioners need to match their services, their interventions, and their resources to the phase of service that the person is in. And this way it helps you to develop really targeted goal plans so people can keep movement in a forward direction. So choose, set, keep, leave is not only a way to think about like the general approach to services, but it also as I consider a periodic review. So every semester we use this approach. So we choose the classes, we get those classes. Early registration, I didn't know what that was when I was an undergrad. I registered the day before classes. This is not advised. It takes a lot longer to finish school. So we want to get those classes, and then we need to keep those classes. And so the decision then is, do we swap out? Is this a class I want, a class I like? So both practitioners and students need to be aware of the add drop period. When we go through this process of choose, set, keep, we also want to consider stop out versus drop out. So add drop is a great time to think about, is this class good for me? Do I know what's happening? Am I organized enough? Like, what do I have to do? Can I move to another class for the bad time? So stop out versus drop out is the larger issue of, do I stay in class? Do I stay in the semester? And this is a choice after add drop is over. And we often consider what are the implications of failing a course or withdrawing from a course, and if there are reasons to do medical withdrawal or incomplete. So we realize that as practitioners, we want to think through what's the impact both on grades, on academic progress, on financial aid, and we want the students to be in the process of those decisions too, because clearly they need to be informed on why it's important not to drop 1,000 classes or to fail many. So to be able to then build onto the framework, I train on 3 prongs of effective services. We identify skills, we identify resources, and accommodation and assistive technology. One of the special notes that I want to make here is we do not duplicate services. The idea is that we want students to be knowledgeable about how to find things in their community and be comfortable utilizing resources in the community. So if there's something exists, connect the person to it. You do not want to create over-dependency on a support education practitioner or any type of practitioner. So for skill development, the way that we think about this is, what are the critical skills that a student needs to be successful in their coursework? And some of this can be done beforehand, but really it's in the moment, like when they're in school, figuring out what they need to do. And we want to use multiple methods to better understand if the person knows that they need to do the skill, if they have some understanding of the skill. The point of skill development from the support education practitioner's perspective is that you teach the skill. It may be hard to do, but if you teach the skill, you never have to worry about the person using the skill, right? So once you develop it, then it becomes a tool in their toolbox. So it creates some level of skillfulness, obviously, and independence. So there's many ways of teaching a skill, and lots of practitioners don't know how to do that, but there are resources out there. But one of the things that you should be mindful of is that most people know what are the things that you would have to do to, let's say, do time management, but they may be missing a couple of behaviors or steps so that they can actually do it. And that's what practitioners should really focus on. What are the things that are missing here to make what you're doing much more successful? So in resource development is really exactly what it sounds like. So we're developing skills. What are the things that you need to do to be successful? And then what are the things in your environment that you need to have? What's available to you? And on the college campus, it's rich with resources. So what's available, and do you currently use it? And then figuring out why, if you're using it, what does it look like, how often, is it helpful, what are the things that are missing, and kind of filling in the holes, right? So you're kind of cultivating this idea of, well, that's a typo, foundation PF, community inclusion, so say of, but this is really the foundation of community inclusion. We want people to really look at the resources that are available and start to fill in their holes. So this is one of the things that we're teaching, is not only helping people get connected to resources, but developing resources for people and with people. And so we have these two prongs: skill development, resource development, and then the third piece is accommodations and assistive technology. So as you can see in this slide, it says for a fair selection, everybody has to take the same exam, and please climb that tree. So with the understanding that the educational system is not designed for all learners, it's designed for some learners. And while this is changing, it's slow to change. And so we can have a whole other webinar on universal design of learning and why we should utilize this principle. So we're going to really focus on how do we create an environment so a student can be successful. So during the time of developing skills and resources, we also want to be able to better understand what are the accommodation needs, if any, and assistive technology needs for college students with psych conditions. So as you may or may not be aware, that right now our current process of determining and approving accommodations is flawed. We have a cycle that is typically an uneducated cycle. Most ways that this process is conducted on college campuses is that a young person, or any person, goes to their psychiatrist or psychologist and say, what type of accommodations do you think would be helpful for my physics class? And they'll say, I don't know. Well, hopefully they would say, I don't know, but that's not usually the case. So the psychiatrist, the psychologist, or the other qualified mental health practitioner helps the young person, or tells the young person what a reasonable accommodation could be for their psychiatric condition. And then the Office of Disability Services, ODS, then determines if this is reasonable. And in many disability services, there's little to no education on what's available. So we have this uneducated loop of people who are well-intended, but they do not have enough information. So what usually happens is that students get these very generic accommodations. And I can tell you they are extended time on test and reduced distraction taking environment. And sometimes you get classroom recordings. So this is what every student gets. And it may not be helpful, right? If you think about extended time, not all students benefit from extended time. It just means more time to procrastinate, right? So extended time is not always the answer. It could be the answer for some. So that's why in these types of services, practitioners then are the experts in being able to understand, be knowledgeable about what accommodations this technology is available, and then be able to better match what the student needs to the accommodation. So practitioners, as I train them, then become helpful in determining accommodations. And I put helpful accommodations here because often the accommodations that students receive are not helpful to be able to mitigate or modify the task for their condition. So many people ask, well, when do you get accommodations and when do you do skill development? And I do both. I train practitioners so that they can do both at the same time. And clearly, to be able to receive accommodation, you have to be considered to have a disability in the classroom and then have a reasonable accommodation. So as you can imagine, the functional implications of some psychiatric condition could actually be different in an English 101 class versus a calculus class. So one accommodation letter and two blanket type of accommodations may not be necessary in English versus calculus. So for a practitioner then, being educated on the essential functions of the course is critical, because then you can really start to determine what are the things that are affecting you, and then how do we determine accommodations that do not modify the essential functions, that don't change them, but that we can modify the approach to demonstrating those. So meaning there are certain things that can't be changed, right? And then if you understand what are the things that can't be changed, you can figure out around those things what are the effects of my condition, and then how do I modify those with assistive technology or accommodation. So this way, practitioners can actually break that chain of that well-intended but uneducated chain of determining accommodation. One of the things that we don't do very well, I think, generally speaking, is assessing assistive technology. And assistive technology is a young person's like right-hand man these days. So we are seeing a less reliance or low reliance on accommodation and a greater reliance for utilization of assistive technology. Everyone has computers in classrooms now. So thinking through how to use that to reduce the feelings of feeling different in the classroom is critical for young people. So with that, I am going to turn our discussion over to Kate Beagle, and she will talk about some of her work in evaluating support education programs.
Thank you, Michelle. So let me just make sure that I'm in the right place. Okay, hoping everybody can see this. Somebody will tell me if we can't. So I'm going to spend, I have about 15 minutes to share with you some of what we've learned from a recent research project that we conducted here at the Transitions RTC, thinking about what do we know about model approaches to addressing and thinking about support education in the field for individuals with serious mental health conditions. And our goal really here is to understand what's happening with supported education, and we really feel as part of doing that is to understand and actually go visit and spend some time with innovative programs around the country, talk to stakeholders there, and also talk to services. On this slide you'll see I have a bullet that talks about delivering supports and receiving supports, and I think that's, I just want to highlight that because that's really important to our center and the way we work, that we really want to understand what's happening in terms of delivering and receiving services from both ends of the spectrum. And as an aside, I think we actually don't know a lot about what the experiences of students are. There's not a lot of literature out there around that, so that's an area we're interested in exploring as well. So I am going to talk about a recent study we did with RTI, which was supported by the Office to the Assistant Secretary for Planning and Evaluation, or ASPE. This was a project really to do what I would call a state of the science of supported education. So it was really an up-to-date literature review, everything that we know that's out there as of the end of 2015, to then really talk to some stakeholders and experts in the community. These may be researchers, these may be providers, and really finance people, really understand what do we know about supported education. And then the final piece, which is what I'm going to be talking about, is identifying some of these programs around the country and actually doing site visits there and spending some time. I call these actually support education initiatives, and I do that because some of them are not what we considered supported education with a big S and a big E per se. And one of the takeaway messages for me from this work is really seeing that there are a number of ways to support the education goals of individuals with mental health concerns. So let me talk about the methods for a quick sec. So how did we identify these programs to visit around the country? So again, referencing this larger study that we did, there were a number of initiatives around the country that were identified in the literature review. There were 10 of those. And then when talking to key stakeholders, doing that environmental scan, we were able to identify 13 additional programs. And then finally, in talking with some research and training experts who really focus on support education, we were able to identify 2 more programs. So we started with an N of 25, and then we actually asked our environmental scan participants and our research and training experts, if you were to think about innovative programs that are happening right now in the U.S., where should we visit? And from that, we got a list of 15 sites. So we went from 25 to 15. And then we had to identify some selection criteria. And knowing what we knew about the state of the science, about what kinds of programs are out there right now, we identified that we wanted to have one program that was targeting individuals with a first episode of psychosis. So these were going to be primarily younger adults in that transition age period. We also wanted to hit one program that was grounded in a community mental health setting, because that is also a place where we were likely to see these initiatives. And then to have one that was grounded in a post-secondary education setting, so on a college campus. We intentionally did not identify programs that serve specific target populations like veterans or sitting in clubhouses. And finally, we wanted to make sure we got some geographic diversity. Our methods further were that for each of these sites, we did 2 days of site visits in April of May of last year. We worked very closely with leaders at each of these sites to really take the lead from them about who were the key people that we needed to speak with at their site to learn more about the history of the program, what kind of services they offer, how do you engage participants, how do you fund it, what are the challenges, are you collecting data, are you evaluating what you're doing? And we really, again, took the lead from these leaders about, should we do these one-on-one meeting group discussions? And again, at each site, we really made a point to spend time with individuals who are actually using and receiving the supported education services. So without further ado, where did we go? So very quickly, 3 places we went. One was the Early Assessment and Support Alliance. So this is called ESA. This is a statewide effort in Oregon, which is focusing on young adults who are having a first episode of psychosis. It is not specifically around supported education, but supported education is part of the mix of that program. So that's our East Coast contingent, or sorry, our West Coast contingent. On our East Coast contingent, we have the Learning Enhancement and Resource Network, LEARN. This is a program that Michelle was talking about. And this is a more, I would say, traditional type program where it's a standalone supported education program in New Jersey. It's grounded in a community-based mental health setting, and it serves individuals of any age with any mental health conditions. And then finally, we visited the University of Minnesota. This really is a fairly different beast than the first 2. It's really a campus-wide initiative to really think about and address the mental health needs of students, and really about how do you prioritize mental health in part of a campus setting. So this slide, I'm not going to go through it now, but I put it in here because I think it's a nice snapshot of how these programs stack up against each other and similarities and differences. So for folks who will be downloading the presentation later, I think this gives a nice snapshot for you. So I want to spend some time, and we don't have a lot of time, so I will tell you later where you can get more information, but for now, a quick snapshot of each of these programs. So ESA is a program that's been around for about 15 years now. It started in 5 counties in Oregon, and it really came from the Oregon Health Authority having an emphasis on implementing evidence-based practice to minimize disabilities for young adults with schizophrenia-related conditions. About 5 or 6 years after this initial implementation started, there was then a statewide mandate that the ESA program go statewide. ESA currently has 24 teams in 36 counties in Oregon, and it really serves the majority of the state, and supported education has been a part of the program from the beginning. For the ESA site that we visited in any given year, they serve about 400 clients, of which usually around 40% of them are involved in some sort of schooling. ESA is designed as a transitional program, so it's not meant to be there. You're not meant to be in the program for a long time, around 2 years. And it's really, as I said before, this evidence-based practice focus. So there's a set of evidence-based practices that are happening within ESA, so person-centered planning, cognitive behavioral therapy, and individual placement and support for supported employment. I would say the philosophy of ESA is really a whatever it takes. What do we need to do to support this young adult in, health, recovery, wellness, etc. And so with 40% of students in some sort of education program, clearly school is a piece of that. What was interesting at ESA is that I expected going there that we would see education specialists on all these teams, and actually that was not the case. With the ESA sites that we visited, we did meet one education specialist, but it was actually somebody who worked part-time, so it was not even a full-time position, and learned that the majority of the work of supporting these education goals is happening through occupational therapists. And ESA folks actually made quite a pitch for OTs, saying that the skill set that an OT brings really is matching what is needed to think about education in terms of thinking about assessing the barriers to the ability to learn, about thinking about how cognitive information is processed, about having the capacity to conduct environmental assessments, and to think about sensory needs that may impact learning. Also clearly identified as a benefit was that in Oregon, that OT, that there was able to do some billing for third-party payers. I believe that's not the same in other states, but in Oregon that was clearly an advantage. When ESA first started in 2001, it was actually funded through some Medicaid dollars. Things have changed, and it is now really a compilation of funding that has come together. So in 2015, $6 million, which includes a whole range of things: state general funds, Medicaid dollars, some private insurance dollars, some vocational rehab dollars. One interesting thing that's happening with funding in ESA is that as part of billing for IPS, so supported employment, there's a Medicaid billing code for that, and they are in the process, and it may have even happened by now since we visited about 6 months ago, in terms of creating a modifier to that supported employment code to be able to bill for some supported education activities as they relate to supported employment. Now, while this does not increase the total funding base, what we heard is that this really legitimizes thinking about education services, and it actually gives permission to the folks delivering the services to really focus on education. And there's so much focus on fidelity, it can make it, what we heard was it was making it hard for providers to really think about how can we get education in the mix. There are two really interesting initiatives and pilots going on at ESA that I want to mention quickly. One is called Project Access, and what that's doing is it's taking ESA out of that transitional focus. So it's not just for 2 years, so you can have services beyond 2 years, and that you can be in services up to the age of 30. So expanding the length of time you can receive support. And there's also a pilot program called Youth Hubs, and the innovation there is that it's opening up the eligibility criteria to not just be about individuals with first episode psychosis, so it can be having a range of mental health concerns. So these are some interesting models and changes that we'll be interested to learn about. I should say, let me go back quickly, that if you're interested in ESA, one thing you can do is, in the New York Times recently had an article on December 28th called Programs Expand Schizophrenic Patients' Role in Their Own Care, and it discusses a variety of programs targeting first episode, and ESA was highlighted along with their Director of Care, Tamara Sale. So I really recommend seeking out that article. Next is the Learning Enhancement and Resource Network. This is LEARN. This began in 2007. This is very different from ESA in the sense that it's really a standalone service, and it's housed in a community mental health center. The Learn program serves about 4 counties, but there are programs similar to Learn that are also around New Jersey. So ultimately, there is very much almost a statewide kind of effort around support education. Our visit was really just with Learn. Learn is actively working in 10 different with 10 different community and 4-year college settings, and they currently, in any given year, are serving about 80 students across 4 counties, and their services are time unlimited. So a student can be at any age, and you can use the service as long as you need those supports. And I think that fits very much with what Michelle was talking about how people may be coming in and out of services at different times. One of the things that I think really stood out about Learn is that it's a very standardized approach to training and skill development for students. So a real emphasis on using tools, creating comprehensive plans of cares, using academic wellness plans and crisis plans, really helping and working with students to identify and be very systematic about what we need to be thinking about in terms of support, and also really doing a lot of emphasis on staff training. Staff training is something that is an ongoing activity, coming together, talking about cases, but also learning new skills, new tools, etc., moving forward. Learn really emphasizes a rehabilitation focus. So this is, again, what Michelle was talking about. So this is not, rather than doing for students, registering students for classes, doing their add-drops forms, really working with students to teach them the skills to be able to do these activities on their own. So it could be doing it together the first time, and maybe the next time with a little less support, and maybe the next time able to do it on your own. And students actually pointed out that this was really useful to them, not only in the school setting, but then this enabled them to have skills that they can use in other aspects of their life. So this seemed like a very positive approach. Learn has a very small team of education coaches, which includes a bachelor's level person, then having an education specialist and a clinician at a master's level, and then a team leader. Most of the time of these Learn teams is really spent in the community and on the campuses. These Learn staff really know the campuses inside and out. They're working quite closely with departments of disability and counseling. The contract, this is funded through a contract with the Division of Mental Health and Addiction Services. They have had a single contract for the last 10 years. There has never been any funding increases to that. So as such, as costs have increased, some of the agency funds have been used to offset the support education contract. And again here, I think the innovation with Learn is really on this skill development and training, both at the staff level as well as at the student level. Finally, our last site visit was at the University of Minnesota. This was a really incredible visit. So the University of Minnesota, I've never been to Minnesota. It's lovely. It is the largest college in Minnesota, and they serve over 62,000 students across 5 campuses. And the driver really for thinking about psychiatric disabilities on campus came from the Disability Resource Center. In any given year, the Disability Resource Center sees about 2,000 students, and the single most prevalent set of disabilities that are coming to them are psychiatric disabilities. So 45% of folks who are coming to have some sort of disability accommodation are coming with psychiatric disabilities, and the majority of those are for depression and anxiety. And this was surprising to me. May not be to some of you, but it really was to me, and it's far and away the largest. You know, the second most prevalent are attention ADHD type disorders at 20%, and then medical conditions at 14%. So really mental health conditions are front and center. Anyway, fast forward, Disability Resource Center received an award from the Department of Education to really look at and explore on other campuses. How are you addressing this really, what is so prevalent for us, these psychiatric disabilities? And from that project came a final report where they really highlighted a set of key strategies about increasing awareness on campus, strategies for decreasing stigma, about how do you get referrals between departments, and also strategies on clarification, coordination, and communication among those key campus stakeholders. Then the amazing thing that happened was this report got into the hands of the provost, and from there the Provost Committee on Student Mental Health was established in 2005. And this really has been amazing. This is really that top-down leadership that the highest level of the university is saying, we need to be thinking about mental health, we need to be raising awareness about issues related to student mental health. We need to be thinking about policy change specific to mental health. We need to improve conditions on campus for students with mental health conditions, and we need to serve as a model to other campuses around the country. And I think they really have. Many of their efforts have been highlighted around the country, that they've been how they've addressed mental health. So staffing, this is really a question does not have an easy answer. It really depends on departments, and it's mostly health and counseling, but they have some really interesting relationships with other departments like the Learning Abroad folks and the International Student Center. I'm going to hurry up here because I know I'm running out of time. And there's no additional money, so what people do really is they figure out how to take the resources they have and morph them into ways that can address student mental health. Very quickly, what do these sites share? A lot of the things that we've talked about in both these webinars, the importance of recognizing academic and human capital, that education is really a key and foundation to individual growth as well as to professional and career development moving forward. Top-down leadership is important, and this idea of thinking very functionally and concretely and dissecting the skills. What do you need to help people to have a successful experience, and thinking about mental health as it specifically relates to academics.
Thanks. Thanks, Kate and Michelle. Wonderful presentations. And I have some questions for you guys. So first, one question came to us earlier on, which was asking about gap year options for students who may be socially adept but are having difficulty maintaining a daily schedule. So how would supported education services work with students who are in between and not yet quite in college?
So for gap year students or students who are in between? Well, I think that, as Kate had talked about, the programs that I help develop are career development models, and so they're actually alongside or integrated with employment services. So I think for a student like that who have intentions of going to school for the following year, it would be smart to get them connected, because if staying to a daily schedule is difficult, being able to work on skills like calendaring and to-do list and identifying what needs to happen, because sometimes that kind of proactive planning is left to last minute, and getting into school last minute is more difficult to do. You're then often relegated to community colleges, which is a good option, but if that's not what you want, then you have to have some pre-planning. So for students who have barriers with prioritizing, planning, kind of those type of executive functioning skills, getting them connected to earlier is smart, because you don't have to wait till you're in school to get services. So programs like that would be helpful in the execution of a longer-term plan that may not have the immediate need, if that answers the question.
Okay, yes, thank you very much. So we have another question here. How can we help students socially on campus?
I think that's a really good question. In my work with students in both providing services, developing programs, and then doing the research that we've been conducting at Rutgers for the last couple of years, that being able to do skills teaching is important. So sometimes students just don't have the background knowledge of how to make small talk. So there's a social skills training workbook for people with schizophrenia that provides a lot of good feedback. I think that practitioners can be really helpful in being strategic in how you develop those skills, and then having students try them in real environments. Like, what do you do in class when you walk in for the first day? Like, how do you make small talk, or how do you find groups, or what are your interests, right? So I think that there's a way to develop these skills naturally in a college setting, because high school is hard. That's like the hardest thing that young people can go through. Kids are mean, and in college they can find people who are more like them. So being able to feel more comfortable and identifying who their preferred groups are would also be really, really helpful.
Marcia, can I add to that?
Sure.
At the University of Minnesota, I think a big part of what they did is really to make an effort to take the stigma out of mental health. And I think when mental health becomes so much of a part of just the underlying fabric of a campus, then that helps to take that stigma piece of it away, so you're not in that other category. And the campus had what hopefully all campuses will have, so Active Minds chapters, where students can, students who are experiencing similar challenges can come together. But they also had a lot of innovative programs which were not coming at things as you're a student with a mental health issue, but really addressing the underlying how that's showing itself, so about stress and anxiety. So they had a very active, I don't even know, I can't remember what the term for it is, but where you pet the animals, where the animals come in the petting zoo and called Pause.
Pet therapy.
Thank you, yes. Where you're petting they have a pony. Everybody knows I'm obsessed with this pony and a chicken, and they come once a week, and we happened to be there when this was happening, and it was mobbed. I mean, the number of folks who were there just and sitting in a group, and they're talking to each other and petting the animals, and so it creates a community where one may not have been before. One other quick example, at Minnesota, they do something super cool called Cirque de Stress, and the head psychiatrist from the health department there on campus gets dressed up like a ringleader, and they do all these team building and de-stressing type activities as a group. So I think they're finding ways of bringing people together around what may be an underlying condition is presenting itself around stress or anxiety or whatever, and coming together in a non-stigmatized kind of way and learning some skills. So I was very impressed with that.
Well, that sounds amazing. The Cirque
it is amazing.
What? Cirque de what?
Cirque de Stress. De-stress, as in, less. I know. If you Google it, you can find it.
One of the other things I just want to add to your point, Kate, which I think is an opportunity for young people, is that they just don't need to make friends with other people who are in disability services, right? So like the greater campus is amazing for that. And I know that exactly. Barb and her colleagues do a lot of work around real community participation.
Yes, agreed.
Just to let you all know, our recordings of this will be posted on our website. Please come and visit it, and you'll be able to download the slides. And feel free to send us questions. We didn't get to everybody's questions. We'll be happy to talk with you through email. Also, a little advertisement. If you want to learn more about the ESA program in Oregon, they will be presenting at the Tampa Mental Health Conference this March. Please visit University of South Florida and the Tampa Conference. And also, we are having one more webinar coming up in the spring with Lori DeGalbo on educational accommodations. Very detailed presentation about how to design accommodations for students with mental health conditions. So that'll be great. Thank you all, and look forward to the next one.